I want to start this video and talk to you about a huge word for me, which is passion. I love what I do. And I always say, if you look in the doctor's eyes and they look bored, like they don't want to be there, I think you're in the wrong place. What does passion do? It means number one is I'm going to give you the best that I can give. And because I'm in what's Michaela Csikszentmihalyi talks about is a flow state. Like right now I'm in a flow state. I love talking on video. I love operating. I love injecting. So passion is so critical to deliver the best. And here's the thing about passion. It doesn't stop. You want to get better. And however good you are, the next year you got to be better. And how do you get better? Education. So I'm an educator. I lecture, I speak, I write, but I also read. I also attend lectures. I also think. I also speak with my colleagues and continue to get better. So a huge part of what Lam Facial Plastics and what I am about is passion. The next topic I want to talk about is artistry. Artistry is huge. What is being an artist? Well, I'm a painter. I work with sculpting designs. I've done all the logos for my building, for my new home. I'm actually picking all the furniture. I'm looking at how everything is structured. Every aspect of my life is about art. When I have free time, I look at paintings. I go to museums. I live, breathe, eat, and think about art. What gets me angry is things that are unartistic, things that are ugly, things that are brutish. And so my passion when I work with you is to deliver very beautiful artistic things. So what I want to have you understand is when I talk to you, I'm going to be very blunt. I don't mean to be blunt in terms of rude, but I'm honest. So I'll tell you, here are the things that you need to do. I want to help prioritize for you because you don't know. I've been doing this for 20 years. I know the things that will help you. And so that artistry is to say, look, I look at the canvas, which is your face, and I think, what are the things that would help you look better? And that's really the key, is that passionate mixed with artistry allows me to do awesome work. So this is not just a word out of my mouth. It's truly a way of life. It's truly a deep core of who I am. I'm going to talk about an analogy of Apple computer. Now, I love Apple. That people don't. My wife is a big fan of Samsung and with Androids. It's not a big deal if you're not an Apple fan. But Apple, the reason I like it is they have basically done the design work from front to back. They do the software, they integrate the hardware. They're now building out their own silicone. They're actually building the entire design of every part of it. It's fully integrated. So when I look at a patient, I really look at it comprehensively. Some people don't want surgery. They say, look, whatever you do, Dr. Lam, don't talk about surgery. Some people say, look, I don't want fillers. I don't want the small things. I only want surgery. And what I find is by doing all of it, being able to do beautiful fillers that look natural, that don't look crazy, because if I do a great facelift and someone goes and does some horrible fillers for you, you're not gonna look right. If I do great fillers and someone does a horrible rhinoplasty or facelift, you're not going to look good. So I look at the entire gamut of what I do as being able to offer you a package and controlling the entire experience so that your end input it's going to look really, really attractive and good. And also I'm able to tailor it. So a lot of people, if you're talking to people that only do only do surgery, the surgeons will say, look, there's you've got to do surgery. And those that do injections say everything lives, breathes, and eats. You have to do injections. You can't do surgery because it's dangerous. It won't work. And I see both sides of it. I see some things like if your neck is sagging, I'm not going to fill that. Okay, you've got to do a lift. I'm sorry, it's not going to happen. If you've got a huge hump, yeah, injectable fillers in the nose could help, but you really need a rhinoplasty. If you've got a small thing, okay, maybe injectable rhinoplasty. If you got a little bit of fillers, a little bit of hollowness, fillers would work well. But if you got a huge eye bag, you need eye bag surgery. So this is the art of being able to tailor your budget, your desires, and also expressing the limitations. Because I'm able to do everything from small to big, I'm able to help guide you and give you the best advice. We live in a world that's growing in complexity, and today the problem is we have to specialize. As a facial specialist, I don't do breast, body, butts, other parts of the body. So when you start to try to do everything, it's already hard enough to keep up with what's going on with the face and the hair in this one compartment. It's a lot of work to stay up to breast with what is new and awesome. If I were trying to do everything, I can't give you the best. You need to specialize. So I think the other word that really defines what I am as a specialist, I really focus and hone in on the things that can make you look good. The problem is if you over-specialize, you only do one little thing, is you can't create a balanced result. And so for me, that is the next word, which is balance. Balance is a component which is about having all the areas look right. So if you think about it, if I do a great neck lift for you and you have huge eye bags, it's not going to look right. Or if I do these great fillers for you and you got a saggy neck, it's not going to look right. It's not going to be balanced. So the compartments that I help my patients think about would be face, neck, and hands. Those are the areas I work on. So if the hands, I do fat grafting there or whatever it may be. If the neck looks old and face looks young, I've been doing Botox all the time, it won't look right. So everything has got to be in balance. And so a lot of times people think about naturalness being just not being overfilled and weird. Really, it has to do a lot with total balance. That brings me to the next point, which is naturalness. Everyone wants to look natural, except for a few people. Those that don't want to look natural, and I have some of those patients that say, look, I don't care if I look unnatural, I want to look unnatural. Don't come to see me, okay? The thing is, I'll tell you, I pick my patients as much as you pick me. And I always tell my patients, I love referrals. I'm honored by their trust, by having people you refer to me. My only request is if someone really has big fake lips, they have big fake cheeks, they like it, they want more of the grossness, don't come and see me, because I'm going to tell them and be honest with them. I'm going to tell them, look, you don't look natural. We got to fix this. And so unnaturalness really bothers me. So my standard of natural, though, is much higher than yours. I always tell my patients who are afraid of looking at natural that they can be at a cocktail party and try and look at 5 women and go, look at all, they look so fake. And I'm going to say, you missed another 10 over there. They had a fake rhinoplasty, they had a fake facelift, they had a fake eyelid surgery, they had a fake hair transplant, they had a fake chin implant. I can see things you cannot see. It takes years to develop the eye to see things that are subtly wrong. And so that's why when I give you counsel, when you come in here, don't be offended if I tell you look unnatural. Because you may never see it, and you may be walking around looking unnatural, and you may think you look good, but you may not. And so what I always like to do is be brutally honest with my patients because, hey, look, life is short. I want you to look great. I want to be and have that honest, transparent relationship with you to tell you, look, these are the things we should do. These are the things we shouldn't do. Here's your budget. But naturalness for me is I have a much higher standard of naturalness than you may even think that you have. The next word I'm going to use is boutique. I'm not really in a rush to do, 3 facelifts in a day because I'm tired. And I'll be honest with you, when I do a nose or a face, I really just do 1 a day. And of course I do smaller procedures that day. I may do some fillers, some lip corrections and other things that I do, lip surgeries, little eyelid procedures. But 1 major procedure a day allows me to stay fresh, focused, to do great work for you. A lot of places, they have surgery on Tuesdays or surgeries on Wednesdays. I try to operate almost every day. Friday's not as much, but it allows me to stay fresh and focused. Think about yourself come 6 p.m. after a long day of work. Do you want me to do your rhinoplasty? Probably not. So for me, unlike other places where they may do 4 rhinoplasties in a day, I stay completely focused. I give you my best. So it's really a boutique environment. We're a fully Joint Commission accredited surgical facility, which basically means we're very safe. We've had the highest reviews every time we've been reviewed, and it's all done on site. You don't have to go to a hospital unless you have major other problems. But in general, for most people, I'm able to do it right here in my surgical facility, and I really give you a boutique environment. Even my anesthesiologists are handpicked; they're not from a group, and I really think you're going to feel the difference when you come here. I also want to talk about your experience. I have a lot of patients that are very needle phobic. They're afraid of getting near with an injection. Now, I'm not saying everything I do is 100% painless, but it is virtually painless for the vast majority of what I do, especially when you compare it to elsewhere. Like my Botox treatments, you don't feel the needles. How is that possible? The reason is that I do a vibration technique. So our brain can perceive pain or vibration, only 1 signal. So if I put a busy signal to say, look, you can't feel the pain because I'm giving you overwhelming vibration, it's taken years of work to develop this, then you should not feel significant discomfort. So people that have had Botox fillers, other office treatments done elsewhere, you simply are marveling at the fact that this is not as uncomfortable by a long stretch. Did you know that they actually did a survey and they found that the #1 reason patients don't go back to a doctor, is to a cosmetic provider, plastic surgeon, whatever it may be, is not because of bad results or a bad relationship. It actually has to do with pain. And so even if you have a high pain threshold, I always say, look, you can fly economy or first class, I'm giving you a first class experience. If I can make that discomfort level very low for you, it's important to me. And I look at the lowest common denominator, which is, look, how can I make this experience good for you? And recovery minimal, all those things. I'm striving always to make the experience better. So I hope this video talking about naturalness, the fact that I specialize in what I do in the face only, the fact that I really am passionate about what I do and that I do really artistic work has a resonance with you. This is a way for you to connect with me and for me to present who I am as a human being, as a person. And you're going to see that personality when you come and see me because it's authentic, it's real, it's who I am. And that is what I bring to the table every single day and when I see you. So I look forward to seeing you as my patient.